Hi, this is Suzanne Bowe, Nursing One Skills Validation on how to give a rectal suppository. The first thing you would do is go ahead and do your 5 rites of administration and then perform the 6th rite of documentation after the procedure is completed. I would go ahead and walk into the room and say, "Good morning, Mrs. Smith, how are you today?" And then they would respond, and I would check her ID bracelet to make sure I have the right person. I would have her repeat her name and date of birth. I'd check that again some more. And then I would go ahead and check for signs of gastrointestinal symptoms. And then I would go ahead and the patient would be lying, of course, on their back, and I would lower their head, and I would raise the bed to a comfortable position for me to administer the suppository. Okay, and then after I have them in the position, I would go ahead and ask the patient to go ahead and roll on their left side and raise their right leg above in the left Sims position. Once they were in the position, I would go ahead and put on gloves. I would locate the anus, and I would go ahead and pull the covers down just so that the anal area is exposed, making sure that they have provided privacy. Then I would locate the anus, and I would go ahead and prepare the suppository. Open it up. And I would go ahead and lubricate the end of the suppository, the tapered end, like so. And then I would go ahead and also lubricate my index finger on my dominant hand. Of course, that would be all lubricated. And then I would ask Mrs. Smith to go ahead, would you please breathe in slowly, so that would relax the anal sphincter muscles. And then I would go ahead and insert the tapered end in slowly past the anal sphincter, about 4 inches in. Okay, then once it's inserted, I would go ahead and wipe off any excess. I would go ahead, if she had trouble retaining it, would hold the buttocks closed for about 30 seconds. And then I would say, Mrs. Smith, will go ahead and have you lie on your side comfortably for about 5 to 10 minutes. I would take off my gloves, perform hand hygiene. I'd make sure that I would drape her before I do that. And then I would also give her the call light and say, when you have the urge to go to the bathroom, use the call light and I'll come in and help you. And after taking her to the bathroom and putting her back into bed, I would ask her, how are you feeling? Did that relieve your constipation? And if she says yes, then I'm finished with the procedure. I would go ahead and document that, and I would document it on my MAR, and I would go back and document it on the computer. This ends this part of the assessment, and we're going to follow me into the kitchen. I'm going to show you my homework that I completed. We did virtual clinical excursions. This is chapter, we did chapters, I got 15, exercise 2 is here. Now we skipped 16, we did chapter 17, oral medication administration, exercise 1. As you can see, I did all of those. Okay? And then I also did in the book, Fundamental Concepts and Skills for Nursing, I did chapter 33. And chapter 34. And this ends all my presentations. Thank you.